transgender inclusion in clinical trials, a call to action on Transgender Day of Remembrance. This Transgender Day of Remembrance today, we face a pressing call to action, addressing the glaring underrepresentation of transgender and non-binary individuals in clinical trials. This isn't just a gap in healthcare data, it's a barrier to equitable treatment and understanding. Shockingly, fewer than 1% of clinical trials in the United States include transgender or non-binary participants. However, this lack of representation isn't due to disinterest. A survey by the PAN Foundation revealed that 65% of LGBTQ respondents are eager to join clinical trials. Despite historic mistrust in medical research, the LGBTQ community is committed to advancing medicine. Yet 80% of respondents stated that they've never been invited to participate in clinical trials. This oversight perpetuates exclusion and leaves the healthcare field ill-equipped to meet transgender and non-binary health needs. Through initiatives like opening doors to clinical trials, the PAN Foundation is working to change that. Their ComPANion Access Navigators address barriers like transportation and basic costs while offering resources to combat mistrust. The message is clear. The LGBTQ community belongs in clinical trials, and it's time to demand more from researchers, policymakers, and healthcare providers. Inclusion isn't optional, it's an obligation. Every voice matters in shaping equitable healthcare. And for more information, visit clinicaltrials.panfoundation.org. Now that's more of an editorial than almost a news story, but it's easier said than done. If you're not in the room when medical professionals are making the decision on who to include in the trials, and it's not probably simply made by looking at demographics. It's probably looked at a number of things that the drug company has as their, agenda for getting it. It's going to be difficult, despite the folks who say they want to be included, to get them included because they're not in the room when that decision's made.
In our last story, we were talking about, transgender folks playing in sports, right? So they're opposed gender. And without that needed data, we will never, ever really find out what is the deal there, right? That data is so important. If we're not counted, then we're not counted. If we're not all counted, then we don't have accurate data on anything. When I went through breast cancer a couple of years ago, I went seeking out LGBTQ and breast cancer. And I got to tell you, it was very difficult to not find a pamphlet that didn't have a blonde Karen on it explaining her breast cancer journey. It was very difficult to find out what the stats were for our trans siblings. It was very difficult to find out what, at what rates people were getting diagnosed, etc. So I can only imagine for other things in healthcare, it's the same.
And the exclusion of minority groups have always been a problem with clinical trials and medical research in general. But to address some points is that's actually we should encourage the overseer of these research. These research are often, if it is done at the university, they are overseen by the Institutional Review Board, which is IRB. As a doctoral student, I have to go through it, and I only did social sciences, but hard sciences is much more stringent. And these boards need to issue new regulations that would include more groups that are marginalized or otherwise not counted. That's how to do it. A bunch of doctors is not going to determine the parameters of the research without someone else's approval.
Mm.
This was actually, I think that's a very brave foundation, because at the end of the day, they're taking on the big pharmacy companies on how they do their clinical trials. Like, that's really brave of them, because normally when you're trying to do medical advocacy, big pharmacy you go and ask for a donation from, and now you're actually telling them how to do that stuff. So I thought that was great, because it really does matter. I remember there was one of the controversies when they were doing medical trials on HIV with AZT, was actually done in Miami, where they tried to do a double-blind study. But AZT had such clear effects that people knew which people did and didn't get it, so they were sharing the pills amongst each other. The health officials were very upset about that, but people were just trying not to die. And making sure you actually talk to the community and have proper representation really matters with clinical trials. So it was great to see an organization starting to do more on this.
Plus, diversity costs nothing in this case. The medical trials already budgeted in to give X amount of people. It doesn't matter if the X amount of person are black, white, gay, straight, trans, etc.
Yeah.
So how do you think? You clearly have some medical background.
No, I have a PhD in I have a PhD in social sciences, not a medical
Is
background.
there a doctor in the house?
I actually never thought about it. When I read this story, I was like, oh, I've never even thought that we need to include trans people into, because it's just never in the conversation.
Because you're not trans.
And and then when I saw it, I was like, oh, well, it makes perfect sense. Not necessarily just for the social part of it, but because there's drug interactions. But trans people are generally, a lot of them are on
Gender affirming meds.
Yeah, and you have to know what those interactions are going to be with whatever drug is being tested. So, and as you were saying, it's such an easy fix. You can just get 3 or 4 trans people and put them in the trial. That any big city is going to have trans people there that probably want to be included in there. So it's an easy fix and easy solution.
One thing I'm going to do with this story is actually circulate it to some trans friends and say, are you even aware that this is a potential issue out there? Since the election, I've said to a couple trans friends, if you were to make, a top 5 most important trans-related issues, where would, women in collegiate sports and all, where would that come in? Would it be in your top 5? Would it be in your top 10?
Health and housing. That's okay. I went to a forum the other day for Trans Day of Remembrance, and that's exactly what the trans community, that's basic needs. Right. Is what they need. It's healthcare and housing.
Being safe on the street, economic related issues, which is probably one of the things that the Democrats didn't push hard enough and failed in this election for. But it would be interesting to see if any of them, this is the first time I'm hearing of this as an issue in the trans community. Be interesting to see if even they would be aware of it.
Good point.